So MGD basically sounds like it is meibomian gland dysfunction. So your glands are dysfunctional. So over time, those glands can become what we call clogged or obstructed. And patients always ask me, well, how is this? What did I do? And so we're still learning a lot about MGD, but we do know that it's a high association with your blink capacity, your blink rate, which we know is automatically reduced when you spend a lot of time on a computer, kind of like what we're doing now, a device or a tablet throughout the day. There has been studies to show that your blink rate is decreased like nearly 50%. So throughout the day, you're blinking a lot less. And I'm saying that I used to tell my patients those glands aren't being triggered. So when you blink, that forces the oil out. And when you're doing that less and less throughout the day, you start to have an oil that can get stuck in that little duct that can become hardened. And then when you finally do blink, you don't get enough to come out. One tough thing is if those glands stay clogged for an extended period of time, they can become atrophic, meaning they just kind of disappear, they wither away. I tell my patients that if you're triggering them and they've become clogged, the brain doesn't think they're needed. And so it just doesn't, allow that gland to produce the oil at the capacity that it should. So basically means that the glands start to get dysfunctional. If it's not caught, diagnosed, and treated, they can become atrophic and they're just gone. And so some of the patients that I get as a referral, they've been dealing with signs and symptoms of dry eye that are secondary to meibomian gland disease for years that was not diagnosed or diagnosed and undertreated. And then they come to me and we are able to scan and we see that those glands have really just kind of disappeared, which makes it harder, not impossible, but harder to kind of manage those patients and get them where their eyes are more comfortable.